Hello children, how are you? Myself Dr. Jayanti Chandrakar, Associate Professor Pathology, and today we will discuss about the hepatobiliary systems. So we will move on the another topic of this disease related with the liver and the biliary system means gallbladder, है ना? So before going to this pathology related to hepatobiliary systems, first we will discuss about the normal anatomy and the physiology of that related to the liver and the gallbladder. Then you can know about better the pathology related to the liver and the gallbladder. All you know about it, but this is just the revision class for you. I don't know how effective are these classes, but slightly it might be help to your study, because in this lockdown process we can't move on the regular classes. तो किसी भी स्थिति में, किसी भी परिस्थिति में अगर कुछ ऐसा है कि हम नहीं आ सकते, नहीं अटेंड कर सकते, तो ऑनलाइन क्लासेस तो ले ही सकते हैं. हाँ, ऑनलाइन बहुत सारी क्लासेस होती हैं और यू कैन सी फ्रॉम द यूट्यूब ऑल्सो, बट द क्लासेस दैट रेगुलरली टेकन बाय द टीचर्स इज़ मोर इफेक्टिव देन अदर क्लासेस. और डिपेंड करता है कि आपको कितना फ्रूटफुल होता है, बट वी विल ट्राई टू दैट यू माइट बी अंडरस्टूड इट बेटर. ठीक है. So here you can see that this is our liver. This is the largest organ of our body. It is pyramidal in shape. You can see that the outer surface of the liver is shiny, smooth, grey tan in appearance. With there is mainly the two lobes are visible, right and the left lobe, but there are the four lobes. ठीक है. As I told that this is the largest organ of our body. It is weighing about 1000 to 1500 gram in adult, and told you that right, left and the quadrate lobe of the liver divided by the falciparum ligament is there. And anatomically these liver are organized into various lobules. So lobular units are there, lobules are there, and functionally these are organized into many acini. We will discuss about it, what is the lobule and what is the acini. Here you can see that it is a hexagonal structure. This is the structure of lobule. So this hexagonal structure is a lobule. This is another lobule. This is another. So these are the lobules. These are with the this portal triad. This portal triad to portal triad, these are connecting here, and these are divided by an imaginary line. So there is an imaginary line that will divide the lobules from one lobule to the another, and in the center of this lobule there is a central vein. So this is portal triad, this is single lobule, and this is the central vein. Now you can see when we put a line from the one portal triad to the another in a horizontal way and connect in the center of this central vein, so it will form a triangle. ठीक है. तो ये जो triangle बना in this way, and when we divide it into three part, so it will be 1, 2 and 3. So this triangle is a acini. This is the functional unit, and this is the anatomical unit of this liver. So जब ये 1 से 2 this triangle is formed, this is the acini, and this is divided into according to the blood supply, or this is the central. So it is the central part and it is the most peripheral part, and in between the central and the peripheral part it is mid-zonal. So it is the zone 1, zone 2 and zone 3. From here this is that, or either it is named as a pericentral, or it is periportal, and it is mid-zonal. So three part is this lobule is divided into three part: central, pericentral area, mid-zonal and the peripheral zone, or zone 1, zone 2 and zone 3. So you can see here also one thing, these are the hepatic cords and these are the sinusoids, है ना. यहाँ से ये blood cells, liver cells रहती है, in between these liver cells there are the sinusoids. And what is the structure of the portal triad? Hepatic artery, portal vein and the bile duct. So these three main structure are there in the portal triad. ठीक है. So that blood comes from this hepatic artery and the portal vein through the sinusoids to the central vein. ठीक है. So from here the most of the blood, सबसे ज़्यादा blood कहाँ रहेगा? This in the peripheral part near the portal triad, and सबसे कम here in the central part. So the chances of necrosis is more where? Here the pericentral zone or zone 3, that more prone for the necrosis, or this periportal or peripheral zone or zone 1, it is more prone for the toxic injury because liver में सारा metabolites होता है. So metabolites come, or this drug or any intoxic materials comes from the blood, first comes near the this peripheral part, then from here sinusoids it goes to the central vein. So intoxication of the drug or metabolites comes first in the peripheral zone or periportal, and the more prone for the necrosis is the central zone. ठीक है. Here you can see the basic structure of the lobular units. These are the hepatocytes, this is the portal triad, and this is the central vein, and these green are the bile canaliculi, or this will form the, these are the bile canaliculi, this is the bile duct. These all traverses through the this sinusoidal spaces, and this is the central vein. Here the three-dimensional view of that central vein, portal triad, this is the hepatic artery, vein and the duct. This is also the three-dimensional view. From this central vein it goes to the form the vein and drain into the inferior vena cava. Here the portal triad, these are the hepatocytes, and from here this is the hepatic ducts, bile canaliculi, bile ducts are formed. From the this hepatic artery and the vein, it form the that blood drain in the this sinusoidal spaces. From this sinusoidal space it goes to the central vein. This is also the same the photographic view of that. Here that hepatic portal vein and the hepatic artery form the, here it will form the central vein in the center of this, and in between these hepatocytes there is a bile canaliculi and form the bile duct. So as I told you that hepatic lobule, hepatic lobule, that it is a hexagonal polyhedral structure bound by the imaginary boundaries extending from the portal tract to the portal tract. I told you in a before slides. And center of this lobule is a central vein. Portal tract में क्या क्या होता है? Bile duct, hepatic artery and the portal vein. Then portal area is bounded by the, yes, this is one thing. Portal area or the portal tract, उसके आजू बाजू की जो हेपेटोसाइट्स होती हैं, सो दैट इज अलग से कोई बाउंड्री नहीं होती उसकी, बट दीज हेपेटोसाइट्स फॉर्मिंग ए बाउंड्री. ठीक है. तो दिस विल फॉर्म द एक लिमिटिंग प्लेट, दैट पोर्टल एरिया इज बाउंडेड बाय द लिमिटिंग प्लेट ऑफ द हेपेटोसाइट्स. ठीक है. एज पोर्टल ट्रैक्ट के आजू बाजू का पोर्टल पेरीपोर्टल एरिया, एंड सेंट्रल वेन के आजू बाजू का सेंट्री लोबुलर, एक्चुअली है ना, सेंट्री लोबुलर एरिया. ठीक है. दिस इज द सेम वे इन अ डिफरेंट डायग्राम बस. vein is there, this duct, and from here that hepatocytes इस टाइप से जुड़ी होती है. मतलब ऐसा रहता नहीं है जैसा कि लिखा बना रहता है कि एक सेल इधर से जा रही है, एक सेल इधर से जा रही है, बट दीज आर लाइक दिस, कभी इधर से कभी इधर से, एंड इन बिटवीन दैट देयर आर द साइनोसॉइडल स्पेसेस. This is the zone 1, zone 2, zone 3, central vein and portal vein in the hepatic artery, then bile ducts. That it is the periportal, centrilobular and the midzonal area. इस हिसाब से we can divide it. 3 unit. So this was the acinus actually, basic units. Now here you can see these are the hepatocytes. ठीक है, and हेपेटोसाइट, दो हेपेटोसाइट, फिर हेपेटोसाइट्स के बाजू में क्या रहेगा, साइनोसॉइडल स्पेसेस, है ना. तो दिस इज द साइनोसॉइडल स्पेस. यू कैन सी दैट हियर आर द दैट कैपिलरीज, एंडोथेलियल सेल्स आर देयर, है ना, एंडोथेलियल सेल्स, एंड in between these endothelial cells there are the Kupffer cells. These are the macrophages of the hepatocytes. ठीक है, दिस इज द बेसमेंट मेम्ब्रेन ऑफ द एंडोथेलियल सेल्स. फ्रॉम हियर दैट ब्लड ये पोर के थ्रू ये इधर हेपेटोसाइट्स में पहुंच जाता है. ठीक है, एंड यहाँ पर आपका पूरा साइनोसॉइडल स्पेस है तो यहाँ पे ब्लड रहता है. एंड दीज आर द हेपेटोसाइट्स. these hepatocytes connected with each other, but there is a small canaliculi will be formed. थोड़ा सा स्पेस रह जाता है यहाँ पे. that will form the canaliculi, and these canaliculi fuses together and form the bile duct, और bile canaliculi फिर bile duct बन जाती हैं सब एक साथ मिलके. ठीक है, and in between these endothelial cells there is a pores. ठीक है, and there is a जो एंडोथेलियल सेल्स और हेपेटोसाइट्स इसके बीच में एक थोड़ा स्पेस दिख रहा है. ठीक है, और एवरी हेपेटोसाइट्स के यहाँ पर एक एक छोटे छोटे सेल हैं. दीज आर द ईटो सेल्स. दिस स्पेस इज कॉल्ड द स्पेस ऑफ डीसी. ठीक है, ये जो है बीच में स्पेस, दिस इज द स्पेस ऑफ डीसी. एंड यहाँ पर जो है ईटो सेल्स, ये रीजनरेटिंग सेल्स होती हैं फाइब्रोब्लास्ट टाइप की. ठीक है, दैट इम्पोर्टेंस ऑफ दिस वी विल डिस्कस इन लेटर ऑन. in a cirrhosis it will be very helpful. ठीक है, so sinusoids are lined by the endothelial cells. Below the endothelium there is a single row of the hepatocytes, and there is a space of DC between the endothelial cells and the hepatocytes, and adjacent hepatocytes form the bile canaliculi, और ये bile canaliculi से bile duct of the portal tract में जाएगा, and then it will drain into the common bile duct. ठीक है, these are the hepatocyte, this is the sinusoidal space, this is the endothelial lining, and from here in the sinusoidal spaces blood comes from the hepatic artery and the portal vein, and these drain into the central vein. This is the actually we see in our histology slides. तो देखो यहाँ पर we can see that identify the portal tract, we can identify the central vein, बट अलग से ये हेपेटिक लोब्यूल है ये नहीं समझ में आता. बट एन इमेजिनरी लाइन इज ड्रॉन फ्रॉम द पोर्टल ट्रैक्ट टू द पोर्टल ट्रैक्ट, एंड इन सेंटर ऑफ दिस इज अ सेंट्रल वेन. देन वी कैन आइडेंटिफाई दिस इज द लोब्यूल ऑफ द लिवर. ठीक है, but these hepatocytes we can identify, these are the hepatocytes, and in between these hepatocytes there are the this is the spaces, these are the sinusoidal space, or here is the portal triad. ठीक है, and by this we can divide this lobule into 3 units or 3 zones actually, zone 1, 2 and the 3, periportal, centrilobular and the midzonal. Blood comes from portal triad, and from this sinusoid it is going to the central vein. ठीक है, so there are the blood supply of the liver. There are mainly dual blood supply. ठीक है, डबल ब्लड सप्लाई होता है. 75% फ्रॉम द पोर्टल वेन एंड 25% फ्रॉम द हेपेटिक आर्टरी. Blood from both these vessels supply the vascular sinusoids. These sinusoids run between the radial cord of the hepatocytes and drain into the central vein. फिर central vein drain into the sublobular vein, which unite to form the hepatic vein and that drain directly into the inferior vena cava. ठीक है? Now the liver functions. All you know that it is the largest organ of our body और बहुत सारे फंक्शन होते हैं. तो सभी चीज़ों का मेटाबॉलिज्म, सिक्रीटरी फंक्शन, एक्सक्रीशन, सिंथेसिस, बहुत सारे फंक्शन होते हैं. ठीक है. सो इन जस्ट द few words that metabolic functions, there is a metabolism of carbohydrate, fat, protein. Mainly the fat का ज़्यादा होता है and the carbohydrate का थोड़ा कम होता है, but it is helpful for the metabolic function of the carbohydrate, fat and the protein. Then certain secretions of the bile acid, salt and the pigments are secreted from the liver. Excretion of the bilirubin, synthesis of albumin and many coagulation factors are synthesized here. Storage of the vitamin K is synthesized here actually, है ना? And carbohydrate and the fat is also stored here. फिर सबसे ज़्यादा detoxification of any drug, toxins, ammonia और सबसे ज़्यादा कहाँ होता है? liver में होता है. ठीक है. So there are the various functions of the liver because a huge functions of the liver. Their function test, no single test can be detect the whole of the function of the liver. कि सारे function सही है कि नहीं, we cannot detect just by a single test. So there are the battery of the test are there कि हमें कौन से function को detect करना है. आइदर मेटाबोलाइट फंक्शन को करना है कि सिक्रेटरी फंक्शन को देखना है कि लिवर की इंजरी को देखना है, मतलब क्या देखना चाह रहे हैं. अकॉर्डिंग टू दैट लिवर फंक्शन इज डिवाइडेड इनटू वेरियस कैटेगरीज एक्चुअली कि कौन सा फंक्शन आपको देखना है. तो बहुत सारे एक पैनल बना हुआ है, LFT बोलते हैं हम उसको, है ना. LFT पैनल लिवर फंक्शन टेस्ट के लिए पैनल बना हुआ है. तो उससे हम अलग अलग चीज़ों से अलग अलग चीज़ें डिटेक्ट करते हैं. लाइक दैट हेपेटोसाइट इंटीग्रिटी. ठीक है. हेपेटोसाइट कैसा है, क्या है, सही काम कर रहा है कि नहीं. फॉर दिस द साइटोसोलिक हेपेटोसेलुलर एंजाइम्स आर देयर टू मेंटेन द हेपेटोसाइट फंक्शन. ठीक है. सो फॉर दिस वी विल डू द AST ट्रांस अमाइनेजेज एक्चुअली. इसको SGOT एंड SGPT भी बोलते हैं, AST ALT. This is mainly AST is for the cardiac functions are also helpful, but अगर liver के लिए करना है तो ALT is more specific actually. So ALT अगर liver cell की कोई injury हुई है then it will increased. These are the transaminases. ठीक है. So and this AST or SGOT, this is increased in the liver as well as with the myocardial infarction also. ठीक है. And LDH, lactate dehydrogenase, it is increased in a tumors involving the liver. अगर कहीं से मेट्स हो रहा है या liver cell की injury because of the tumor cells are there, then LDH will be increased. ठीक है. So this is for the hepatocytic injury, AST, ALT and the LDH. ठीक है. Then another functions of this excretory function of the liver. So excretory functions of the liver, for this we will perform the bilirubin, serum bilirubin. It is in two forms, total and the total में conjugated and unconjugated both are there, and then the conjugated. तो एक conjugated निकाल लेते हैं और total निकाल लेते हैं. Then when we deduct this direct from the total, then we can know the indirect one. ठीक है. This covalently linked to the albumin. So in the serum bilirubin also we can detect it, and along with this we can detect it in the urine bilirubin and bile acids in the serums. This will perform the excretory function of the biliary systems or the hepatic systems. Total bilirubin is increased in a hepatocellular, any type of the jaundice actually. When the bilirubin is increased, there will be the jaundice in our body. So increased in hepatocellular obstructive or the hemolytic type of the jaundice, we will discuss it in the later class. Then alkaline phosphatase. This is the plasma membrane, and this will be because of the damage to the bile canaliculi. So when there is a obstructive type of the jaundice, obstruction में bile canaliculi का destruction होगा. So because of this, these enzymes will be increased. So serum alkaline phosphatase will be increased in a obstructive type of the jaundice and certain the hepatocellular jaundice also. Hepatocellular jaundice, हाँ, ठीक है. And then the gamma GTT, gamma glutamyl transpeptidase. This will rise with the along with the alkaline phosphatase and but specific for the hepatobiliary disease. ठीक है. Then serum 5-nucleotidase. This was also increased with the alkaline phosphatase for destruction of the this plasma membrane of the bile canaliculi. तो bile canaliculi का अगर डैमेज होगा, then these 3 enzymes will be increased. ठीक है. So these all are included in a LFT. ठीक है. क्या? बिलीरुबिन में टोटल इन द डायरेक्ट वन, देन SGOT, SGPT, LDH, सीरम GGT, एल्कलाइन फॉस्फेटेज, सीरम 5-न्यूक्लियोटाइडेज. तो अलग अलग इसका अलग अलग इम्पोर्टेंस है कि विच टेस्ट इज परफॉर्म्ड फॉर विच फंक्शन ऑफ द लिवर. ठीक है. देन हेपेटोसाइट का फंक्शन प्रॉपर है कि नहीं है, फॉर दिस वी कैन मेजर इट बाय द प्रोटीन सीक्रेटेड इनटू द ब्लड. ठीक है, मतलब सिंथेटिक फंक्शन एक्चुअली. सीरम एल्बुमिन. So this will perform the metabolic function of the liver. That serum actually total protein we will measure it, and that along with the albumin and globulin also. ठीक है. So total there is a hypoalbuminemia is there in a hepatocellular disease, and hyperglobinemia occurs in the cirrhosis and chronic active hepatitis. Many of the clotting factors are formed here in a liver. So these are tested by the prothrombin times. By this prothrombin time and partial prothrombin time, this will increase in a hepatocellular disease. Because so if hepatocytic injury is there, hepatocyte function is not proper there, then the prothrombin time will be increased here. Then serum ammonia. This is increased in acute fulminant hepatitis, cirrhosis, hepatic encephalopathy. That plasma ammonia level will be increased. Then another is aminopyrin, breath test, galactose eliminase test. These are the minor type of the test we can perform, but these are rarely done. So these were the functional test of that, but for the any liver injury or any of the mats or tumor are there, then we can do the USG ultrasonography या फिर FNAC biopsy we can take to diagnosis of the liver disease actually क्या है कैसा है. तो another test we can do, some other immunological test we can perform here, but these are the rare type. मतलब नॉर्मल रूटीन LFT में इंक्लूडेड नहीं होते हैं. रूटीन LFT में अपने जो रहते हैं, दीज वर द टेस्ट. नाउ द डिजीज रिलेटेड टू द लिवर. द अभी तक हमने पढ़ा जस्ट द एनाटॉमी एंड द फिजियोलॉजी. डिजीज पार्ट, द पैथोलॉजी पार्ट ऑफ द लिवर वी विल स्टार्ट हियर. सो इन द फॉलोइंग लेक्चर्स क्या क्या पैथोलॉजी हो सकती है. Jaundice is the actually symptom. All you know the jaundice. ठीक है. Then we will read the hepatitis, acute, chronic, fatty liver, cirrhosis, vascular disorders are there, and tumors. So under these headings, we will move on to our following lectures. The diseases regarding the liver. ठीक है. Okay.